In a guideline meeting, people come together to reach consensus about complex topics in a very short amount of time. Sometimes these discussions can be unbalanced. Certain issues might receive undue weight, while others receive too little attention.
The purpose of this framework is to help people who are making recommendations about health systems to systematically think through each of the considerations that's important in making a recommendation.
The framework highlights the most important considerations or criteria in making a health system recommendation. This helps to ensure that all of the important criteria are considered. Before the panel meets, a technical team will have prepared evidence for each of these criteria. This evidence is presented in a short format that is easy to understand and use during the meeting. This keeps everyone on the same page and helps focus the discussion. Sometimes this information is linked to more detailed summaries of the evidence, which the panel can turn to if there is disagreement or questions. Having gone through the evidence, the panel members then make judgments about each criterion. In some cases, the technical team may already have made tentative judgments for the panel to consider. People might make different judgments based on the same evidence. By explicitly focusing on each criterion, on the evidence, and on the judgments being made, panel members can more easily see where their disagreements lie and resolve these. Looking across the judgments they've made for all the criteria, the panel can then weigh the balance of desirable and undesirable consequences and make a recommendation. In this way, the framework helps make the panel's thinking transparent so others can see how they arrived at their conclusions.
We created this framework to help groups make well-informed and transparent recommendations. The framework also can be used to help policy and stakeholders to use those recommendations and make decisions that are appropriate in their specific contexts. For example, local evidence can be added to help inform the judgments they need to make about some of the criteria.
Lastly, the framework captures implementation considerations, as well as areas where more research is needed.